Thank you, Christine, for that overview of health literacy. Nicola says, brilliant presentation, so informative. There's a couple of comments here from Tina Walker, who talked about unconscious bias, and knowledge is nice, but action affects change, and unconscious bias then holds us back. Tina, I don't know if you wanted to add anything to that at all.
I think that we see some people who are really what I call prosumers. They know everything, they do things fine, and they you know, but often the material and our efforts and interventions are targeted at those who are already well off. Then we have very large group called the consumers, the worried well, that would need just a bit of guidance, and then they can handle a lot of things fine. But we also have a big group who are a bit lost in the information jungle, or concerned really what to do, and they also struggle with loads of health problems. And we do see those who have a low self-reported health and who are highly using the system. They also often have limited health literacy. So those who are really struggling, they are also often the ones that we should be really taking care of in a way where to know how can we best support them. And then you have the what I call the non-humorous, who are really the groups that are very hard to reach. It can be migrants, it can be where it could be a language barrier, it can be people who are homeless, where they're difficult to reach through normal societal infrastructures, and it can be people who are very ill, and they would need special care and many more resources. So the idea is that we have much more tailored and people-centered approaches in the future, rather than one size fits all, which has been the tendency even here in the pandemic, to just do one size fits all. But it needs to be tailored.
Tina, did you want to make a comment at all?
Yes, actually, I think the clue is there in the unconscious bias. It truly is unconscious, and I think we have to be really mindful that everybody has it. And I'm part of a BAME group, and we discussed our own unconscious bias. And I was listening to something last night that was talking about Desmond Tutu flying out of Lagos, and he was really pleased to see that the pilots were black. And then they hit turbulence, and he said his own thoughts were, there isn't a white man in the cockpit. I wonder if we'll survive this. And that's unconscious bias at work. So even if you think you're not racist, even if you think you won't judge people, my lived experience is abuse, and I run an organisation for abuse, and there's a really good lady that's done some research around this, Jessica Taylor, and she's done her whole doctorate about the unconscious bias, and she's trained police forces with the knowledge around abuse, but then tested them afterwards. She did it in the Isle of Wight. She tested their change in values with some very careful question, and their values hadn't changed, they were just more knowledgeable. And so I do think that that's something we should be really, really aware of, because change won't happen unless we actually challenge that unconscious bias. We're all conditioned by it for various reasons. I think with the whole Black Lives Matters, we know we've been conditioned through our schooling.
You're very right, but it's difficult for some, I would say, some countries and societies to admit that this happens at a structural level. So yes, it's important to keep speaking up, because when many, you know, every voice counts in this.
Yeah, and I would say that's true in Britain too.
Thank you, Tina. Please don't go away, because the second half of the presentation, we've had a really excellent overview from David around sort of the historical and policy context of all of this, and then from Christine around the whole role of health literacy and how, as organisations, they have to improve their ability to support health literacy at all levels as well.